Chiropractic. Naturally get rid of pain and boost performance. The body is intelligent and can heal itself. From this idea, chiropractic has evolved around an art, a science, and a philosophy. Our brain and the nervous system control the body. Our body gives back information to the brain. So, they depend on each other for us to be healthy. The brain and the medulla are protected by the skull and the spine. The nerves leaving the spine go to all the systems of the body, the organs, the glands, the muscles, etc. An imbalanced body is the sign of a dysfunction, and one dysfunction has a consequence on the whole system. At the spine, we lose mobility and irritate the nerves. But how can we have an imbalance in our body? A fall, car accident, repetitive movements, bad diet, stress, bad postures, they all can have a cause on our muscles to be too tense and our articulations to move less. A dysfunction causes our body to become old much sooner. And there are 4 consequences. Damage to the muscles, ligaments, and discs. Arthrosis. The nerves will be irritated and we have pain. With a dysfunction in the neck, for example, we can have less movement, we can have muscle spasms, which can cause headaches and pain all the way to the hands. This can happen in almost any articulation. Most patients come to see chiropractors for low back pain, headaches, neck pain, carpal tunnel syndrome, tendonitis, sciaticas, foot pain, hip pain, and many more. But how can we help them? Our art lies in the ability to detect, correct, and prevent articular dysfunctions. And our hands play a major role in this. But first we need to do a full exam. Is this a chiropractic case? No? So, what specialist do we send the patient to? Yes. Okay, where is the cause of the problem? For that, we look at the patient's posture. Are the eyes, shoulders, and hips parallel to the ground? Does the line of gravity go through the ears, shoulders, pelvis, and knees? Then, we look at the patient's breathing. Does the core stabilize when necessary? Does he have a deep abdominal or a shallow upper breathing? Finally, we look at how the patient moves. Do the muscles in his arms and legs work in the correct order, from the hip to the toes and from the shoulders to the fingers? By observing and palpating our patients, we discover where are the main dysfunctions. And each person is unique, so each chiropractic treatment is personalized and includes specific exercises and good habits. Normally, there are 3 phases of care. First, we get rid of the pain as soon as possible. Second, we correct the cause of the problem. And third, we prevent it and help boost performance. For this, our main tool, manual adjustments. It is a very precise and highly trained skill to restore the proper balance to the articulations. Sometimes it makes a pop sound, like when we open a bottle of champagne, but it does not hurt. An adjustment has a mechanical and neurological effect. It restores proper movement to the articulation and the right neurological flow to the area. Simple exercises and stretches speed up the patient's recovery. Exercises to restore proper muscle coordination, stretches to regain natural mobility. To minimize stress and allow the body to recover properly, good postures and habits are taught to patients. Easy to use every day, they are very effective. By looking at a patient's posture, breathing, and movements, a chiropractor has a global image of his case, so he can help him get rid of his pain, prevent it, and then boost his performance. The science of chiropractic is expressed with its education and its research. It is the only health profession with an education standardized at an international level. And from its beginnings, research has been an essential part. Dr. Zingler, an orthopedic spine surgeon, has said, "There are lots of myths about chiropractic care. I decided to look into each one of these myths, and what I found is that chiropractic education, side by side, is more similar to medical education than it is dissimilar." Chiropractic education consists of around 5,000 hours of classroom studies, after which we are supervised seeing patients in the college clinic for 1.5 years. Finally, after passing a government exam, we receive the title of Doctor of Chiropractic. A big part of the studies consists of anatomy, radiology, and neurology, so we fully understand the relationship between the body and the nervous system, and most importantly, to know when we can help a patient and when to send him to another specialist. Scientific research has shown that chiropractic is safe and effective for treating low back pain, neck pain, and some headaches. Today, more research is being made to prove its other health benefits. Other studies have shown that chiropractic helps reduce healthcare costs. That's probably a reason why Switzerland, Norway, Denmark, and others have integrated it into their healthcare systems. The British Medical Journal published a paper showing a patient satisfaction rate of 93% for chiropractic. So, to resume, our body is intelligent. If we cut ourselves, we scar automatically. The same process happens inside the body. Pain is only an alarm, telling us that something isn't working right. It is information to help us find the cause of the problem. Chiropractic is the most popular alternative health profession in the world. Thanks to our knowledge and global view, we help our patients get rid of pain without medication or surgery. And the best athletes and musicians in the world also choose chiropractic to boost performance so that they are at their best when they need to be. Welcome to Chiropractic.